Good morning. I would like to talk about the plan of care for Divine Pearl. Given her recent history of preterm labor with her last two pregnancies, and I would think we should change the plan of care rather than just discharging her on sending her home on bed rest. This patient is at high risk for preterm delivery because of her last two pregnancies were preterm. One was at 32 weeks and one was at 34 weeks, and she's experiencing contraction like pain, as well as this is her third, fifth pregnancy, but third term pregnancy, given that is also a high risk. Other factors of high risk pregnancies could be BMI, severe anemia, lack of nutrition, lack of prenatal care. So we just need to look at her chart more and make sure there's no other high risks for preterm labor. You mentioned a cervical check that was performed. Maybe we could recheck her within an hour or so if she's still having consistent pain and compare it to the last cervical exam, making sure there has been no change. Has her abdominal pain resolved? We should see if the contractions are being consistent. And I would also recommend a transvaginal ultrasound to be ordered next, to see if her length of cervical length has been decreased or shortened. She'll be more at risk for preterm labor if her cervix is less than 30 millimeters. Maybe ask her Divine if she's had a cervical length during the pregnancy and compare those two findings. I would also suggest a fetal fibronectin swab as a diagnostic tool to indicate a positive could predict preterm labor within 7 days. Also, a urine culture should be collected. Did you collect a urine on her because maybe she has a UTI that we don't know about, which can increase her risk for preterm labor, or the UTI is based off her abdominal pain, and we could treat her with antibiotics. Depending on those results, if any of those results are positive, her cervix is shortened, or if her cervical length, her cervical check is changed, we should develop a plan of care. I checked on the ACOG website and they do not recommend bed rest for preterm labor nor risk for preeclampsia. There's no sufficient evidence that this plan of care will prevent preterm labor. So sending her home at bed rest puts her more at risk for things like a blood clot. If everything is negative, she can go home and resume regular activities, and we'll just educate her on consistent contractions, abdominal pain, pressure, vaginal bleeding, feeling gush of fluid. We'll just provide education before her discharge. If any of the tests are positive, like the positive fecal fibronectin, a shortened cervix, or if we rechecked her cervix and it's greater than three centimeters, we might have her admit her for preterm labor and give her corticosteroids, start magnesium sulfate, and as well as provide prophylactic antibiotics for GBS if her status is obviously unknown, and swab her for GBS if she isn't a positive. I think we should try those things, and that will help us see if whether or not Divine is in preterm labor or she's just experiencing Braxton Hicks or abdominal pain, and we can discharge her safely.